Hello guys, I'm Dr. Travis Davis. I'm the primary chiropractor and owner of Laguna Bay Chiropractic. And every day we have people come in to the office that have a specific condition called sacroiliac joint sprain strain or sacroiliitis. And it's a type of sprain strain just like an ankle sprain strain. And I want to take a few minutes to make a video to walk you through exactly what the sacroiliac joint is, how we usually see misalignments, and what you can do to get it corrected. So bear with me and we'll just walk you through this video, and hopefully it's really good and educational and kind of fun for you. So what we're looking at here on the screen is basically the spine, and then here you have the sacrum, and then of course a lot of people know what the coccyx or tailbone is. That's the bone down here. So this whole structure here is what we refer to as the pelvis. Now it's really important because the pelvis, when it's properly aligned, we should see a line that goes across here like that, and that line should be perfectly level. That's going to create a really level sacral base. The sacral base is this right here, and just like the foundation of a house, the whole building goes up straight if the foundation is straight. If the foundation tips or is crooked, then you're also going to see the whole building lean with it. So just think of the Leaning Tower of Pisa. That foundation started to settle and sink, and so the whole building is tipping and leaning. And the same exact thing happens to your spine, and that can cause a lot of pain and be really uncomfortable. So what usually happens is we end up with a rotation. So this is the sacroiliac joint right here, and so sometimes we refer to that as the SIJ, sacroiliac joint. You have one on each side, and each side should bear about 50% of your body's weight. So we want to see that nice and even on each side. So what will usually happen is someone will lift and twist, or they'll have a slip and fall and land right on one side of the buttocks or the other, and that'll cause a twist where this bone, just like an ankle sprain strain, shears away from this bone. So that looks like this. We usually end up with a rotation where that bone rolls up and back, and this bone rolls down and forward, or vice versa. So let me play the video for you, and we'll show you kind of what that looks like. So that's what we're talking about. Now you can see this side is rolled up and back, this side's going forward and down, and that's creating a massive amount of inflammation that occurs not only in the front of the joint, but primarily in the back of the joint, and that's where most people feel the pain. So this is one of those syndromes. If you have back pain in the really low back, and it's specifically off to one side more than dead center, we're usually talking about a sacroiliac joint. A lot of times people confuse sacroiliac joints with sciatica, which is a completely separate condition, but they can feel quite similar sometimes. So sciatica is generally going to be buttock and radiating leg pain. Sacroiliac joint injuries are generally going to be localized, really specific pain to one side of the spine or the other, and it can be quite acute and quite uncomfortable. And because this is the foundation of your whole entire spine, and so many muscles attached to these big pelvic bones, it can create a whole group of other symptoms and syndromes that occur that are based off of this problem. So we can spend all day chasing muscles and working on muscles and working on different biomechanical problems, and all of those things will keep coming back until we actually have the structural foundation of your spine corrected, and that's by correcting the sacroiliac joint. So let's let this video play out a little bit more, and you'll be able to see what I'm talking about from the back side of the spine. So when we look at the back, what we end up with is a twist to the pelvis. So one thing you have is big ligaments that go from here to here. It doesn't really look like this in real life. You have big, thick, strong ligaments that hold these bones together. So when this hip rolls up and back, it actually rips this bone away from this bone, rips the ilium away from the sacrum, and that overstretches those ligaments and causes that sprain strain that we're talking about. And that creates a lot of pain, swelling, and inflammation. So what we do from a chiropractic standpoint is several different things. First of all, we try to figure out what's causing it in the first place. Why are you getting this problem? Is there something that you're doing at home that's actually causing this problem in the first place? Because if we if we fix this, and then you go home and keep doing the same things that caused it in the first place, we're not really going to have a long-term solution to fixing this sacroiliac joint problem. So that's the big thing, is finding out what we need to have you do at home or avoid doing at home that makes this condition worse. Secondly, we want to give you exercises and things that you can do to help keep that joint in place and keep it from going back out of place. And some of that includes lifestyle counseling. So there's proper ways to lift, there's ways to bend, there's ways to pick things up. You don't ever want to lift and twist. And all of that is stuff that we go over in the office with our patients. So that's information that we can give you based on your specific type of injury and what exactly you need to do at home to help yourself and actually also avoid doing that actually make the problems worse. So if you're seeing a chiropractor already and they're not giving you that advice, they're basically setting you up for failure, because you're going to go home and just keep doing the same thing that's creating the problem, and you'll have to keep coming in and coming in and coming in and getting chiropractic care. A condition like sacroiliac joints can be difficult to fix in the sense that it's easy to realign the joints, but because the joint is a big, weight-bearing, strong joint, you use it for almost everything. So it's not like a shoulder injury where you can put it in a sling and let it heal. It's actually an injury that it's hard to keep that joint in place, because every time you turn over in bed, anytime you bend over to pull your pants on, every time you lean forward over the sink to brush your teeth, you're stressing that joint, and there's a good likelihood that you're going to re-injure it. So there's also things that we can give you like sacral belts, and again, the exercises to help keep that joint in place to give you more permanent and longer lasting success. So that's basically a sacroiliac joint sprain strain. And again, it creates a lot of other symptoms like piriformis syndrome, iliotibial band syndrome, which can then lead to bursitis. It can create muscle spasms in your back, but primarily it's going to be that localized pain right in that joint on one side of the lower back or the other. Now again, this is something that's really easy to fix from a chiropractic standpoint. We can manipulate that joint back into proper alignment and relieve the shearing that's tearing the tendons and ligaments, and also help start to reduce that inflammation and swelling within the joint that's most likely causing a lot of the pain. Keeping it in place, that's the hard part. Now we do sell sacral belts that go around. It's like an orthopedic support, just like if you have a sprained ankle or an injured wrist. You can specifically wear a brace that helps you support that joint so that you're not overstressing it and making it worse. It gives it time to heal, and it mostly keeps you from rolling that hip back out of place. So that's definitely something that we can consider doing too, to help the progress happen a little bit more quickly. Additionally, a lot of people do get some massive amounts of inflammation in that joint. Just imagine twisting your ankle and you get that big swollen massive bruise on the side of the ankle. The same thing can happen in the sacroiliac joint. So at home, anti-inflammatories, ice packs, they can all be really effective and quite helpful. And also in the office, one of the things that we can do is class 4 deep penetrating photobiomodulation therapy, and that's class 4 laser therapy. It feels amazing, it's soothing, it's relaxing, it helps tighten those ligaments back up, it accelerates cellular repair so you heal more quickly, but it also reduces swelling and inflammation. So not only do you heal more quickly, you feel better more quickly. So there are a lot of things that we can do to speed the healing of this particular injury up. So that's a summary of the sacroiliac joint injury. If you have any questions or you feel like you may have this condition, go ahead and give us a call at Laguna Bay Chiropractic, or check us out on our website at www.lagunabaychiropractic.com. And we'd love to have you in the office. We can sit down and talk about this a little bit more. I can explain it in more detail. We can give you some handouts to take home to help you with your exercises. We assign an exercise protocol or routine to almost every single patient that we treat, and give you the power to be able to help yourself at home as much as possible. So give us a ring and we can help you out with sacroiliac joint injuries. Have a wonderful day.